What is going on, guys? Thanks for tuning in to yet another video. My name is Anthony Pinto da Costa and you are watching Canadian Physio Student. Alright people, so classes are officially over and it is now Oski season. For those of you who don't know what an Oski is, it stands for an objective, structured, clinical examination. And because of Oski season, we're just practicing day in, day out for hours on end. And today is one day before our Oski, so we're just gonna run through last minute scenarios here in our living room. As you guys can see, it's a complete mess, papers everywhere. We got a suctioning station here too. I'll show you guys that one after. We're just about to head out and go on campus to practice on the beds that are adjustable, because right here we can't adjust this one unless we screwed off the legs, but we're not gonna do that. So we're gonna head to campus in about 5 minutes here, and then we're gonna run through some scenarios. And then after we're done running a few of our scenarios, I'll film me doing a scenario on Reed, and then Reed will do a scenario on me, just so that you guys can see exactly what it's like and what you can expect when you do an Oski in the future, because all of you are gonna get into physio school. So we're gonna head to campus right now and I'll see you guys in a bit. All right guys, so me and Reed have been doing some scenarios for about an hour and a half now. So now we're just gonna film a couple for you just so you guys can see exactly what it's like, okay? So I'll show you the case that I'm gonna do and then I'll just walk through how we go about doing them. Ready to go? Ready. Also, last thing here, if me and Reed miss anything here, don't roast us guys. We're just trying to do our best out here, okay?
Yeah.
Mr. Vander Vleuten, how's it going today?
Good, thanks. Yourself?
Good, good, that's under there. You can check the brakes here, perfect. So my name is Anthony Pinto da Costa. I'm a second year physical therapy student here at Queen's University. Do you go by Mr. Vander Vleuten or do you have any other preferred names?
You can call me Reed.
Reed, perfect, Reed. So just reading your chart out there, I saw that you've recently been diagnosed with rheumatoid arthritis, is that correct?
Yep.
Okay, perfect. So today we're going to be doing just an assessment. I'm going to be asking a few questions about that, just about your morning stiffness that you've been experiencing. I'm going to test your grip strength too, using this blood pressure cuff here. Okay. And then after that, we're just going to be doing more of a physical exam. So I'm just going to be moving your joints around, seeing if there's any swelling and seeing if there's any pain when I press on you, or if I'm moving you through any motions, okay? Okay. Does that sound okay with you?
Yeah, sounds fine.
Okay, so this will require me to put my hands on you. If you feel uncomfortable at any point, if you feel too much pain, just let me know, and then we'll go from there, okay?
Perfect.
All right, do you have any questions before I proceed?
No questions.
You've understood everything I've said so far?
Every word.
And we're okay to proceed?
Yep.
Excellent, okay. So my first question for you is about the morning stiffness. So a lot of times with rheumatoid arthritis, individuals will feel pain and stiffness up to an hour after they wake up, okay? So I want to ask you, how long does it take for you to feel as good as you're going to feel in a given day after you wake up?
I'd probably say around 45 minutes or so.
45 minutes, so below that hour.
Yeah, below the hour.
Okay, so that's good. That's definitely good for people who have rheumatoid arthritis, so that's great. Next thing we're going to do is we're just going to test your grip strength here, okay? Okay. So I'm just going to pump this up to about 20 here. See that? Okay. Make sure it gets into a nice ball shape here. Inflate that a bit. Perfect, okay. So we're just going to do your right one today. I would typically do both sides, but just for the purpose of today, we're just going to do the right one, okay? All right. I want you to squeeze that for me whenever you're ready.
I might break it.
You might break it, okay. Let's see. All right. You can let go of that? You okay? No pain there? No. All right. So that's good there. So we got a reading of 40, okay? So next time we do it, we'll see if you've improved or have decreased from there, okay? Okay. So I'm just gonna throw this over here for a second. Okay. All right, so the next thing we're gonna do is that physical exam that I was talking about. So I'm just gonna be feeling around the areas. You're gonna be moving. I'm gonna apply some joint stress palpation, just like pressing on your joints, and then you're gonna tell me if you feel any pain, okay? Alrighty. Okay, so we'll first start with your jaw joint here, okay? So I'm just gonna put my hands here, just feeling for some swelling. I don't feel any swelling there, okay? So I'm just gonna apply some pressure. Let me know if there's pain there, okay? Is there pain there?
Yeah, that hurts.
That hurts? Okay.
Yeah.
So we're not gonna do the movement component there, okay? We're just gonna move down to this joint right here, okay? So where your collarbone attaches to your rib cage, okay? So I'm gonna feel there too. Is it okay if I go under your skin here?
Yeah, that's okay. Oh, yeah, that's a lot of fluid.
Yeah, definitely feel some swelling there, okay? So now I'm gonna move on to your right arm, okay? That sound okay? So I'm just gonna take you here. Just gonna feel for some swelling here first. So I don't feel any swelling. Just gonna apply some stress here, okay?
Okay.
A little bit of pain, or are you okay?
No, I'm okay.
Okay. So now I'm just gonna bring you through the motion, okay?
That one's okay.
Okay?
Oh yeah, it hurts.
That's the painful one. Okay, all right. You can relax here, Mr. Vander Vleuten. So I'm just gonna prescribe you one exercise just to help out with that elbow pain.
Okay.
So typically what we do is when we're in an active flare-up, which I suspect that you are right now, we don't like to move that joint through the full motion, okay? We just like to keep it in a certain angle here, and then we're just gonna apply some resistance just to make sure that that muscle in that area is still working, and also helps with your pain control, okay? So what we're gonna do is you can just basically have your arm out like this. Excellent. We're gonna put our other hand underneath it. Perfect. And we're not gonna move it through. We're just gonna apply some pressure here and just press into that hand without actually moving the joint, okay? You feel that?
Yeah, got it.
Okay. So say this is pain. We don't want to go to there. We just want to go just below that, okay? So it's got to be just below that pain. We want to hold that for about 3 to 5 seconds. We want to do that every day, okay? For about 5 times within a day, okay?
Okay.
Does that make sense?
Yeah, it makes sense to
Maybe
me.
you can teach that back to me?
Yeah. So I'm gonna get my arm in this position here. Put my other one underneath. I don't want to let it move.
Mhm.
So I'm gonna apply the pressure.
Yep.
I'm gonna push against my hand for 3 to 5 seconds. You do 5 reps times 5 sets throughout the day.
Excellent. We got it down. Perfect. Okay. So just to summarize what we did today, we just did some assessments of your joints just to see if you were in that active flare-up stage. We did find that there was some pain in your jaw, in your upper chest here, and then also in your elbow. You'll continue to do those exercises, and then in a couple days we'll check in to see if they've helped out or not, and then we'll continue to progress our treatment plan from there.
Perfect.
Does that sound good, Mr. Vander Vleuten?
It does.
All right, well, once again, my name is Anthony Pinto da Costa. I'm just going to wash my hands here again. Second year physical therapy student here at Queen's University. It was a pleasure working with you today, okay?
Perfect. Thank you. Kid's a natural.
Yep.
Hey there, how are you today?
I'm well, how are you?
I'm doing well. Okay. My name is Vander Vleuten. I'm a second year physical therapy student here at Queen's University.
Yeah.
May I ask your name?
Tony.
Tony. You go by Tony or you prefer something else?
Tony's good, Tony's good.
I like Tony on you. So Tony, what I've been asked to do today is come in and assess your deep neck flexor muscle strength. So these are the muscles that kind of give us some stability to our neck as well as support the ability to support our head as well, okay? So I'm just going to be running you through a range of exercises and just seeing how you cope with that, okay?
Perfect.
I'll be talking you through each time. Basically, I'm just going to be using a blood pressure cuff to monitor our status throughout, okay?
Okay, cool.
Before we begin, do you have any questions for me?
Nope.
Understood everything I've said so far?
Perfect.
Do I have your consent to proceed?
Absolutely.
Awesome. So on a scale of 0 to 10, what would you currently rate your pain at?
Right now, I'd say it's about a 3 in the neck.
About a 3?
Yeah.
Okay, gotcha. So hopefully these exercises will be able to control some of that pain as well as then prevent further pain along or down the road as well, okay?
Awesome.
Great. So I'm going to get you lying on your back here. And if you could just put your neck in this nice flat space here. Awesome. All right, good. So let's first just work through the movement that I'd like you to perform before I put this blood pressure cuff underneath your neck, okay?
Yep.
So the movement that we're going to be working on is a head nod, okay? So it's going to be, an easy way to imagine it is if you have a rod or an axis going through your ears here. You're just going to try to rotate your head around that axis, okay?
Okay.
It's also known as a chin tuck, so that's another way to think of it. A few mistakes that people make is they often use their big muscles on the front of their neck here.
Mm-hmm.
They move too quickly through it, as well as then they try to push their neck back against the back of or on the bed here, opposed to doing that rotation, okay?
Mm-hmm.
So before we begin, I just want to show you what I mean by those big muscles being activated. So can you lift your head up off the bed? And can I put my hands on your neck?
Mm-hmm.
Now relax. Good. So now can you place your hands where my fingers are? Good. So you feel those muscles turn on right there?
Yep, yep.
That's one of the things we want to avoid while doing this exercise.
Okay.
So if you don't mind, I'm just going to place this blood pressure cuff underneath the small of your neck here. Then you can put your head back down. Good. Is that comfortable there?
Mm-hmm.
Okay, good. So I'm gonna go now, I'm just gonna pump this up to 20 on the blood pressure cuff. You're just gonna feel a slight rise on the back of your neck. Awesome. So now, Tony, I'd like you to trial that movement that I was just describing, the rotation around that axis through your ears or the chin tuck. Okay. So that's looking pretty good. I like how that looks. What I'm going to do now is I'm going to hand this off to you here so you can look at the gauge. And so what I'd like you to do, you can notice how the dial is currently at 20.
Yep.
When we perform that chin tuck or rotation of the head, we want to try to bring it up to about 22. So it's one tick up from what it's currently at right here. Okay, so can you try doing that? Hold for 3 seconds. 1, 2, 3. Excellent, good. Now I'd like you to do the exact same, except we're going to try to hold for 10 seconds, okay?
Whoa.
So whenever you're ready. Good. And while he's doing this, I'm analyzing any global muscle activity, any shaking, trembling, or any neck retraction. Good, you can relax. So you did that really well. So we're going to move up from going to just a 22 to going towards 24, okay?
24.
So this is 2 ticks up, 24.
Okay.
So hold for 3 seconds.
That one's hard.
That one's a little more difficult. Can you try one more time trying to get that hold?
No, I can't do it.
Okay, no problem. All right, so Tony, I'm going to bring this out from the back of your neck. So you did really well today. Okay. You demonstrated the exercise properly, and it also gave us a great baseline from where we can work from here. Okay. So going forward, we're going to try to improve some of the endurance of these muscles in the front part of your neck. So what you can do at home is take a towel, roll it up, put it the exact same position, maybe on your bed or a firm surface, and then you can practice doing those chin tucks, okay? Can you just remind me a few of the things that we don't want to see with that exercise?
Yeah, we don't want those big muscles here to turn on.
Yeah.
We don't want to go too fast. And then we don't want to completely retract our chin back. We want to just rotate.
Perfect.
Right.
So Anthony, I want you to book in with me in like 2 days so we can check your progress. Our ultimate goal is to be able to get up to 26 millimeters of mercury on the dial here and hold it for 10 seconds times 10 reps, okay? So when you go home, try to hold that for about 3 seconds at first, then progress towards the 10 seconds and work up towards 10 reps, okay?
Sounds good.
Ultimate goal, 10 reps times 10 seconds.
Easy.
Do you have any questions for me?
No questions.
Perfect. So once again, my name is Vander Vleuten, second year physical therapy student here at Queen's University. I want to thank you for your time today, and I'll see you in a few days.
Awesome. Thanks. All right, guys, so we got the boot from the CEC there, just practicing. We're back here at the apartment. We're gonna do a few more scenarios just to end the night. As you can see, the sun is setting, so it's almost Oski time. One thing I didn't mention in there is that when you're doing an Oski, you'll actually have an examiner in the room with you too, and they're just gonna be watching everything you do, and they're gonna be staring into your soul like this. Not actually though, but to some extent. But other than that, what you saw there is basically exactly what an Oski's like, except we'll actually have shoes on too. Anyways, I'm gonna show you guys the suction system that we made here, because endotracheal suctioning may also be on our Oski. So I'll show you what we made here just to kind of simulate it from our apartment. So over here we have our personal protective equipment. This is our saline solution, protein shaker, mask, gloves, and then over here is a gown. And then here is our suctioning catheter. This is our ambu bag for administering oxygen. And then over here, this kettlebell, this would be the patient's head. And then right here, we have the trach tube. And then this is the portion of the trach tube that you take off. So you take it off, and then you put the suctioning catheter down here. And then put that back on. And this is the improvisation that you need when you're practicing for Oskis. Anyways, guys, that is basically the video for today. Can't film too much more because we got a lot more situations to run through here. But I hope you guys enjoyed this. I hope you guys like seeing the inside footage of what it's like to be practicing for an Oski. So if you like this video, make sure to like, share, and of course, smash that subscribe button. And if you have any comments or questions, please leave them in the comment section down below, or you can reach out to me on Instagram at CDNPhysioStudent, and we can talk from there. So guys, I will see you at the next video.
Yeah, another day, another dollar to be made. I'm a workaholic, ballin' hard until the grave. Used to wanna be a baller for the NBA, till the fellas around me started dunking in the 7th grade.